So we're here today with Anne-Marie O'Neill, who is the CEO of Thrombosis Ireland. And you're very welcome to the show.
Thank you very much, John.
You might start, if you will, just by telling us, what is thrombosis? What's it all about?
So thrombosis basically are blood clots in the veins. So blood clots cause heart attacks, strokes, but also deep vein thrombosis and pulmonary embolism. So with Thrombosis Ireland mainly deal with blood clots in your veins.
And what about deep vein thrombosis? What's that about?
So blood clots normally form in the deep vein of your leg or your arm, or sometimes in other parts of your body, but most people would get it in the leg or arm. And that is very treatable with medication once it's diagnosed. Our worry is where it's not diagnosed and it's left untreated for a long time, and a piece may break off from the leg or arm and travel into the lung, and this is potentially fatal.
Right.
So we're trying to raise awareness with the general public what the signs and symptoms are of a blood clot so you can spot it, and basically what your risk factors, so what increases your risk of getting a blood clot.
And what are the signs and symptoms? How do I know if I have a clot?
So a blood clot in the leg or arm usually presents as pain in one leg or arm. So it's not in both of your legs. So it's not like you've done a big run. It feels like a muscular pain, but really it's on one side of your leg. It feels worse if you're doing exercise or going upstairs, and reduces as you slow down or start walking on the flat. So it's on one side, one leg or one arm. It's pain or swelling, and maybe a bit of heat in your arm or leg, or
right.
a bit of discoloration in your skin.
I did hear about the heat.
Yeah.
And that's quite an obvious sign there's something up.
Yeah, and the swelling can be significant as well. So, you know, if you measured one leg compared to the other, you'd significantly see a difference.
And you mentioned that they're dangerous if left untreated.
They are. I mean, they're so preventable and they're so treatable. But the problem is that many people don't know anything about them. So they think they've just got a pain and they don't go and get it checked. And we say always get it checked. If you have a pain in one leg or arm with some swelling or some heat or a bit of discoloration, and by the way, you could just have one of those symptoms. You don't have to have all of them. If you're concerned at all, I think the big thing is that you understand what your risk factors. So if you have that pain and you think back that you're affected by some of the risks, then you know for sure they should go and get it checked. So in the leg, we would say, if you get those leg or arm symptoms, you go to your GP, who will then send you to A&E to get a scan or a blood test to check. And then it's medication to treat it.
Does lack of activity and lack of exercise, does that increase the risk of getting it?
Absolutely, it is a risk factor. But the biggest risk is going into hospital for 3 days or more.
Right.
For anything. So once you're in hospital and immobile, you usually have an infection or inflammation, are unwell, and you're probably dehydrated if you're after being brought into hospital. So going into hospital is the biggest risk. 60% of all blood clots happen as a direct result of a hospital stay. And you're also at risk for 90 days after you go home. The same heightened risk. So if you're going into hospital, then you need to be conscious of the signs and symptoms of a blood clot and always go back if you get any of those signs.
When you're in hospital for a longer period, you wear these lovely socks that everybody hates.
Yeah.
But they have a purpose.
They do have a purpose, and not everybody is told to wear the socks. So you listen to your doctor. If you've been asked to wear the socks, wear them. If the socks are extremely uncomfortable, or they're stopping the blood flow, or they're catching behind the knee, then they're more dangerous than they are helpful. So it's really about listening to your body. If the socks are helping that feeling of, you know, keeping the pressure going in the legs and helping your legs, well and good. If you're really uncomfortable with them, I would say don't wear them.
Okay. You mentioned risks.
Yes.
What are all the risks?
So the main risk, as I said, is hospitalisation. That's the main risk. The second risk is cancer. Okay. 1 in 5 cancer patients will get a blood clot. So, and usually in the first 3 months of diagnosis. And the reason for that is that cancer makes your blood sticky, and so does some of the chemotherapy drugs. Plus you're ill, you maybe have to go into hospital for surgery. Yeah. Surgery is a risk factor also. You're immobile because you're unwell and you're lying around the place, so and I'm probably dehydrated. The next one is pregnancy. So if you're pregnant or you've just had a baby, your risk is during the pregnancy and for 6 weeks after you have a baby. So it's about being conscious about that. And the other risk factor is if you're taking any hormone replacement medication orally. So to take it transdermally on a patch or a gel is fine, but for the girls who are taking the combined oral contraceptive pill or HRT orally, it's very important to know that it does increase your risk. The other risk factors would be surgery, as I said, previous family history, or previous personal history of having a blood clot. Once you've had one, you're more inclined, 3 times more likely to have another. Once you've had 2, you're 10 times more likely to have another. So your own personal history. And then the usual factors, smoking, lifestyle, if you're not eating properly, overweight, they all increase your risk. But the important thing to know is blood clots don't normally happen for one risk factor. They normally happen where 2 or more risk factors happen in your life at the same time. And if I'm after telling you those risk factors, that's pretty easy to happen.
Yeah.
I would also say long haul travel, so not just flights. So travelling for 4 hours or more, where you're in a cramped position, comes under the immobility umbrella. Most people know DVTs from flying, and really it's only a 3% risk compared to hospitalisation, which is a 60% risk. But it's where it's combined with another risk, where you've been diagnosed with cancer and you're taking a flight somewhere, or you're having cancer treatment, or where you've been immobile. I mean, even teenagers gaming for long periods of time. We've had teenagers who have lost their life as a result of it because they don't think.
As a result of gaming.
Well, their positions, so they're on these gaming seats or they're on their hunkers gaming, for long period, hours and hours at a time. You're stopping the blood flow. It's all about keeping your blood flowing. Hydration also is really important, that you drink plenty of water every day. And particularly if you're not feeling well, if you're immobile or if you're in hospital, getting moving and keeping hydrated are the 2 things that will keep you safe.
Okay. We deal with people with disabilities here. What advice would you give them? Because a lot of them would be in wheelchairs.
Yes. So I think really all of us, already they would have one risk factor. So they need to be conscious of all the other risk factors that can affect them. I would say ensure that you stay hydrated. Okay. Where movement is possible, get involved, even if it means that you get help to get those legs moving and get the blood flowing. So that's really important, to try and keep that blood flowing. Be conscious of being in cramped positions. So, stretch out as much as possible. And we would say 90 minutes, be conscious. So if it's possible to get up and get moving, just stand up and get the blood flowing about every 90 minutes. So we don't discourage people to travel either. We say if you're going to travel, try and get an outside seat, try and move at some stage during the flight. If you can't get up from your chair and it is possible to do the alphabet with your foot, that helps. It pumps the blood back up. So, spell your name with your toe even while you're in your chair, and that'll help.
Is there a risk at night time, like say an overweight person who can't move around much when they're sleeping? Does that increase the risk?
No, we don't seem to, because you're lying flat and you're not restricted in your position and the blood can flow. Yeah. We say if somebody has some swelling in their leg, from fluid retention or whatever, that you should always raise the base of your bed, even just pop a pillow under the base of your mattress. Right. And that means during the whole night then there's an automatic help to get the blood back up through the body.
Yeah.
I saw on your website that there's a lot of variations of thrombosis or conditions that also cause clot.
Yeah. So what I didn't mention really is when it breaks off. I didn't tell you the signs and symptoms of a lung, and I think that's really important. If you've got breathlessness, pain, sharp pain when breathing deeply, you should always get it checked, and that's going straight to A&E. That's not a GP position, particularly if you've had leg symptoms previously, or if you're under that umbrella of any of those risk factors. So now you're in the danger zone of your lungs. The other conditions, so there are lots of conditions like diabetes, like antiphospholipid syndrome.
What's that?
APS is a kind of a complicated autoimmune condition that affects men and women, and it also gives clots both in the veins and in the arteries. It's a complicated condition that really needs to be treated carefully, and people need to be very vigilant about their anticoagulation medication. Yeah. Usually they're only able to take warfarin, because warfarin is the older kind of anticoagulation medication that keeps your blood thinner and flowing. There are newer drugs called DOACs, which you just swallow. And you never have to get blood tests. Okay. You just once a year you get your kidney function checked to make sure it's working. Other conditions, again, like I said, cancer is another condition as well that can increase your risk of blood clots. But generally it's hospitalisation and any sort of surgery, hip replacement, knee replacement, orthopaedic surgery in particular, because by virtue of the surgery you're immobile as well. Being in a leg cast, people need to be conscious as well. And if they get any extra kind of swelling or pain, that they need to really go back and say, can you check this, scan me, do a blood test and check.
So I'm a person who has just been confirmed as a blood test. I amn't, but say I am. What's the recovery like?
So this is my bone of contention. So there's not a lot of help. If you have a heart attack or a stroke, there's not a lot of guidance in our health system about recovery from blood clots. But as a blood clot survivor myself, I know that it's really, really important that once your medication is in place and it's working, so your blood is anticoagulated to the right level, and your doctor will tell you when. And that's normally a few days. With the newer drugs, or with warfarin, it could be a couple of weeks. But once you're anticoagulated, you need to get moving. You need to get walking, particularly walking, swimming, cycling if you can. So movement, really. Make sure you're hydrated, and look after your mind. That's really important as well, because you've had a near-death experience which rocks people. And I think if somebody has been diagnosed with a blood clot, we need to be really conscious that they've had a fright, and ensure that both their physical and mental recovery is looked after at the same time.
I was shocked to see that clots and clotting are a bigger killer than infection in hospitals.
Yeah. Clots are the number one cause of preventable death in our hospitals. So it's really preventable. And the way we can ensure that it's prevented for us personally is, if you're going into hospital, you ask the doctor or nurse for a VTE Risk Assessment. Whoever is admitting you or checking you in A&E, say, have you checked me for my risk of a blood clot?
Okay.
Once you've been risk assessed, if you are at higher risk, so if let's say you are in a wheelchair or whatever, so you've one risk factor, you're also immobile, they'll check the other risk factors. Are you being admitted to hospital? Have you had a cancer diagnosis? Do you have diabetes? Are you overweight? Are you a smoker? Check all those things. Then you will be deemed a high risk and will be given an anticoagulation injection while you're in hospital. So, but if you haven't been assessed, who knows if you're at higher risk? So ask. We're asking everybody to ask for a risk assessment. It's not mandatory in our hospitals. It is mandatory in the UK, but it's not mandatory here, and we'd like it to be. A lot of hospitals, a lot of the bigger teaching hospitals would have an automatic form that would be filled if somebody's been admitted. But we find that the same standard of care isn't in every hospital in the country. So we're aware that people are in, lots of smaller hospitals around the country. So we want them to prompt it. Say, please risk assess me.
That risk assessment, is that a VTE risk assessment?
A VTE risk assessment, and all it is a questionnaire. It doesn't hurt anybody, so don't be afraid to ask. It's a questionnaire. It takes about 2 minutes for the doctor to perform it, and it could save your life.
So what about Thrombosis Ireland? When was that founded and why?
So many years ago, I had my appendix out, or my gallbladder out, and I ended up getting a blood clot after it. So it was hospital-induced blood clot. And about 5 years after that, out of the blue, I got another one. Obviously, because I'd had a previous one, but nobody had ever discussed it with me. Okay. Also, I ended up getting pregnant and had to go through a pregnancy where I had to inject every day. So my personal experience prompted me to say there's absolutely no support in Ireland. There isn't anywhere that patients can go to get information. Nobody's really, speaking out on our behalf. And it was a lonely time for me. I was in a warfarin clinic with 70 and 80 year olds as a 30-year-old, and I didn't know anybody else who'd gone through it, no matter what age. So I set about just setting up a support group, actually. That's how it came about, really. I was a patient in St. James's Hospital, and I asked other patients would they join me, and one other guy, Shay Kearney, said he'd join me to set it up. And then I realised I couldn't really get funding unless it was a charity, so I had to basically set up a company and a charity, and we were lucky enough in 2016 to become a registered charity. And since then, we're still fully voluntary. And my nurse, when I was pregnant on my son, that worked in the anticoagulation clinic, when she retired, she joined me. So Anne and myself actually run Thrombosis Ireland. We're a small organisation with a board that help us do the legalities. And we have a phone number and an email, and anybody who experiences a blood clot is welcome to contact us or get onto our website, thrombosis.ie. Our numbers and contact details are there. And we will provide an information pack and any guidance you need. We can't give medical advice, but we can certainly guide you to the right place to get the right treatment or the right care, and help you through your recovery. I think it's really important to have somebody that you can speak to. It helps you. It helps your mind as well. I had a difficult time after the first blood clot. I ended up on Prozac for 5 years with a bit of post-traumatic stress. And multiple surgeries and then the blood clot on top of it really just rocked my world. But because it wasn't really caught, nobody really was watching me or explaining anything to me, I kind of fell between the cracks, and I don't want that to happen to anybody else. So that's really what Thrombosis Ireland is about. Yeah,
absolutely brilliant. So do you provide other services, and how many people do you provide service to?
We provide services to anybody who would like to get support. So every year we run multiple information and education events around the country. We've just had one in Athlone. In February we were down in Munster. In September we'll have a big Dublin event. All the information will be posted on our website when it's finalised. It's free. So people can come and learn everything they need to know about blood clots, from the medical end, from the medication end, from the recovery end, psychological and physical recovery. We direct them also to physical recovery workshops that are free with Xwell if they get a referral from their GP, and we encourage them to start their physical recovery fast. I suppose our biggest thing is that we are a voice at the end of the phone to help guide them. Our medical system is difficult to navigate when it comes to thrombosis, because it's depending on where in the country you live and what diagnosis you have. We would have a different recommendation because of our experience with patients who have shared their experience. We also love the fact that people want to share their story. So you'll see on our website that people either do a video for us or even just email in their story, and we post it on the website with some pictures from different circumstances. So we've people who were pregnant and get blood clots, who've had babies and get blood clots, who were on the pill, who fell and broke their leg and got blood clots, who've had surgery and got blood clots, who have cancer and got blood clots. It's such a wide area, but we try and do it through personal, share it through personal stories.
I can vouch for the website. It's full to the brim with information, including, and all of those personal stories are very, very great to hear.
Yeah, I think it helps. It puts a personal slant to it. And people are reaching out because they've had bad experience. A lot of people are misdiagnosed because even some healthcare professionals are not educated well enough. We don't have a full clinical programme for thrombosis like we would for heart or stroke or diabetes. we're campaigning for that at the moment, and we hope to have it later on this year. If there's a clinical programme in our health department, then there's funds put behind it, and people are educated properly at university level, and then they bring it into the hospitals and they're already educated. We're at a point where we're educating them in the hospital on it, which is difficult. It's like walking up a muddy hill. But if everybody prompts and asks for a VTE risk assessment, and if somebody doesn't know how to do it, then they'll ask their superior how to do it, and then we will start making our hospitals a safer place.
Brilliant. Tell me this. If I'm a person, I've just been told that I have a clot, what do you recommend me doing?
I recommend that you check with your doctor within 3 or 4 days that your medication is now working, your anticoagulation medication, and I would say get moving straight away, because if you don't move and well, first of all, I'd say if you've been diagnosed, great. If you think you have let's go back a little bit. If you think you may have a blood clot, it's really important to diagnose it quickly, because the longer it's there, the more damage it's doing to your vein, which can cause a thing called post-thrombotic syndrome, which is a permanent swelling and pain of your leg that takes a long time to recover from, and sometimes people never recover from it. So I would like to say there's a good recovery from having a blood clot, but if it's a long time, if it takes a long time to diagnose it, there could be damage there. So get diagnosed quickly, first of all. When you're diagnosed, get permission from your doctor fairly quickly and get exercise and get walking. I would say get walking every day. 10 minutes, 5 minutes a day first, then 10 minutes a day. If it's not walking, then it's exercise. It's some kind of movement. And if you need to get help, if you're in a chair, get your carer to help you get that leg moving and pump that blood. It's really important. There is also like compression, not just socks, but compression machines where you wrap around your leg and it helps you pump. Right. And you could ask about that if you can't physically move yourself, that it might help. It might be a good idea. So ask your doctor, and also stay hydrated. So if you've had a previous blood clot, be aware that you are at higher risk of getting another one. Not probably if you're on the medication, but a lot of times if you get an unprovoked blood clot, you're only on the medication for 3 to 6 months. When you come off it, you just need to be vigilant. So don't be scared. We have a blood clot alert card. I've brought some along and I leave them with you, and it just gives you all the points, the risk factors and the signs and symptoms, and you can fold it, keep it in your wallet. It's laminated so it'll last, and if anybody would like to contact us, we'll send them one, or I'll give you some for your clients here that you can share.
Of course. Give us out the website again.
The website is thrombosis.ie.
And I can vouch. There's a vast amount of information on it.
And you'll get myself or Anne on the other end of the line. You'll never get a stranger. It'll be either of us. And if you phone us and you don't get us straight away, we will call you back or text us, and we will come straight back to you as soon as we can. We are voluntary. We try and keep our hours between 10 and 2. It doesn't always work. Today is not going to work. I'm working this afternoon. But we don't want to. We want to keep our energy so that we can keep going into the years that follow.
It's been a pleasure to talk to you.
You're very welcome,
full
John.
Of information.
We really appreciate the opportunity to raise this awareness. It is actually life-saving.
Yeah.
And if anybody that hears this information, if they could share it with one other person, share it with their family, with their friends, the more people that know, that's how we're going to get the information out.
Great. Thank you so much for coming on the show.
You're very welcome.
Thank you.
Thank you so much.
Thank you.
And that was Anne-Marie O'Neill, CEO of Thrombosis Ireland.